Hello, and welcome back to TeraRecon's Taxi Line, the interview series that you're going to be watching every day this week at RSNA. My name is Renee Stacy. I am the Director of Product Marketing here at TeraRecon, and I'm really excited to be joined by TeraRecon CEO, Jeff Sorenson. Welcome, Jeff. How are you?
Doing great, Renee. Thank you very much. Excellent first day of the show.
Yeah, absolutely. So today, of course, RSNA is very different, but some things remain the same. First day is always really exciting. We're seeing lots of industry announcements, innovations, partnerships, and of course, TeraRecon made a major announcement this morning with regards to our patent innovations. So I'd like to take just a couple of minutes and have you perhaps unpack that news just a little bit for us. Give us a little bit of insight into the history and the development of our patented technology, and let's kind of start from there.
Great, thanks, Renee. Yeah, it's very exciting. This news is a long time in the making. I think everyone has known about TeraRecon's foray and major investments in the AI space. But what you're seeing here is that when the vision for these products was first created, before any of the investments were made, the ideas were written down. And we did that because we had a very particular view of how the market was going to evolve. We really believed that two things, really. One is that automation was real. We could develop really powerful technology using deep learning, but it wasn't so explainable. The physicians needed to understand how to control it, and they needed to understand how to put the insights into their report. Second thing that we realized was that the results and the interactions that physicians make with images and the impact that imaging can have is actually much bigger than just radiology. Now, radiology is no doubt the nerve center of imaging and even enterprise imaging in healthcare. And I think that's very clear and proven over and over. But the customers of imaging go much broader than that. And so when we were looking at the sort of the problem statement of AI, we wanted to both create a platform with high automation and a platform with explainability and the ability to distribute results downstream. And the report is one very important part of that. It's just a part of that because it's where your results are persisted. But imagine if you persisted them there before you had a chance to understand them or change them. That's a problem. And also think about the fact that the report isn't just the radiology report, right? In many respects, the electronic medical record is a comprehensive report about the patient. The results need to be there. They need to be in many different areas of healthcare specialties. And also with telemedicine, they need the ability to enjoy the automation aspects and still understand these results.
Right. Well, and so what's interesting is that what we hear in the news quite a bit is about the interactivity around AI insights and results. And interactivity means more than simply, I'm going to present these insights to you and you're simply going to accept them at face value. It's really about the availability of these insights, the ability for the physician to actually interact with those results before they make it into the report, but certainly making it much easier for them to ingest into the final report and to start kicking off all of these downstream systems. So, I think our definition of interactivity is probably a lot different from many in the industry, certainly.
Yeah. No, that's absolutely true, Renee. And I want to just double click on a word you use, which is workflow, right? So physicians aren't asking for AI and imaging to be a blood test with a yes or no answer, and that the final value is that there's a result in their report. They're actually looking for applications, and this was one of the big lessons that COVID brought to healthcare imaging. Was we have way too much expertise in very small, very centralized places. So what healthcare is begging for is AI imaging applications that can be distributed much closer to the point of care, and that can create a tight workflow integration with radiology. And then of course we need that report to keep up. And so we saw this requirement. What this patent is really about is that, yes, it covers when you run AI or multiple AI algorithms, the results will end up in the report. But it also, more importantly, includes the fact that you can go from the result in the report to the right place in the images. You can make adjustments in the image or even in the application. Let's call it an application and not just images, right? Because if it's a neuro application, it's a cardio application, there's actually tools and interactions and results and findings working together to create a high value application. That's what healthcare wants. Then of course the report becomes a part of the dashboard that's being used, right? You would want the report and the images and the findings and the data you're using and health information together in a dashboard or an application. And so what we describe is exactly all of that coming together. So I think the radiology definition of a report is rather incomplete, because if you think about it, when you're, even when customers, when there's many customers on this, who are at RSNA making purchasing decisions, think about that, the PACS isn't even evaluated simultaneously with the report. So that explains the level of integration that they have. And of course, there's no answer for then how reporting works outside of radiology, where downstream customers are. And so this is a very foundational, fundamental patent, and I would encourage viewers to go and look online, because it reads in plain English. It's very easy to understand what this patent covers.
That's great. So listen, Jeff, we are going to keep this short and sweet. So I'm going to invite all of our listeners to go to TeraRecon.com and read a little bit more about this patent and the other news that we've got coming out here at RSNA. And great first day. Thanks very much. And I'm sure we will be talking again soon.
Thank you very much, Renee.
Thanks. Have a great night.